One of the lifestyle choices that has an increased risk of spinal disorders is body weight. As much and as hard as sometimes it is to keep our body weight average for our height, it's important to maintain your body weight at a normal level. So sometimes in patients who are having trouble and are asking me, hey, what can I do to lose weight, feel better, get in better shape? Sometimes I'll refer to Dr. Phil Golia. He is a nutrition expert here and really helps condition my patients with regards to taking the body weight pressure off of the discs and off of the facet joints to prevent degenerative spine disease. So that's one main lifestyle choice that is best for you, is body weight loss.